Our next speaker from this evening is Dr. Nicholas Simard from Toronto Metropolitan University, or TMU. Dr. Simard is a biomedical engineer specializing at the intersection of big data and neuroimaging. After earning his PhD from McMaster, Nicholas joined the IAM lab at TMU to translate complex MRI and CT data into clinically impactful tools. His research focuses on multimodal integration, developing novel machine learning methods to unify these imaging types to identify brain variability and ensure that high-risk patients, receive a clearer, more accurate diagnosis. Although French-Canadian by birth, Nick traded in his Maple Leaf status for the sun for a little while, where he spent 2 years island hopping in the Philippines with his wife, where he finished writing his PhD thesis in paradise. Don't we all wish we were there in a Canadian February? Please welcome Dr. Nick Simard.
Medical imaging is a marvel. It is a window that lets us see what lies within without ever picking up a scalpel. With medical imaging, we can see the intricate architecture of the human brain, like in this magnetic resonance image, or MRI. But more importantly, we can see when tragedy strikes, like in this computed tomography or CT scan, showing a life-altering stroke by the arrow in red. The goal of my research is to use these marvelous windows to not only understand the outcome of a stroke, but also identify who is at risk and how can we prevent future complications. My name is Dr. Nicholas Simard, but you can call me Nick. And I work at the Image Analysis and Medicine Lab at TMU. I started my journey in MRI because it is the gold standard. MRI is incredible at differentiating between tissue-tissue boundaries, those fine edges and borders between different parts of the brain, like in white matter or in gray matter. And using MRI's tissue precision, we're able to find subtle stroke warning signs like intraplaque hemorrhage, or IPH, which manifest as small white spots on an MRI. But IPH, they're unstable collections of plaque, acting like a ticking time bomb. When they go off, a stroke happens. In my most recent research study, I investigated over 300 patients who are historically susceptible to stroke and found a striking IPH pattern. Men over the age of 70 are 5 times more likely to suffer a stroke within a 2-year span if they have a dominance of right-sided IPH. This discovery enables clinicians to intervene and provide life-saving treatments to this high-risk population before tragedy strikes. But, reality check, although it provides a wealth of information, MRI is a marathon. It takes at least 15 minutes just to take a baseline brain scan. On top of that, there's an issue of access. MRIs are expensive. They require massive magnets, specialized hypercooling, and heavy infrastructure. For context, in Canada, we only have 450 MRIs for our 40 million plus population. And in stroke, where every second counts, we don't have time to wait for beautiful pictures. We need answers now. And that is where CT takes the lead. If MRI is a marathon, CT is a sprint. It's accessible, inexpensive, and can capture a comprehensive brain scan in under 1 minute. This makes it essential in fast-paced environments like the emergency room. So think of CT as our first responder in identifying a stroke. But while CT is really good at giving us the big picture, it's not sensitive to detect tissue health. So things like IPH go undetected. So, CT versus MRI. What's the most valuable modality? Well, what if I told you we didn't have to choose? By using multimodal medical imaging, I'm developing a translation software that standardizes both CT and MRI so they speak the same language. With using machine learning, we are able to map CT images directly into the high-detail MRI space, essentially teaching a computer to extract MRI-level knowledge from a CT alone. This is a game changer because now we can take that 1-minute scan, translate it, and identify those previously invisible IPH ticking time bombs. With this translation software, whether you're a young mother in the heart of Toronto or a senior scientist all the way in Nunavut, everyone gets the same gold standard care. And on top of that, this multimodal framework isn't limited to stroke. We can adapt this for diseases like Alzheimer's, Parkinson's, even multiple sclerosis, providing sophisticated research insights to all neuroscience communities. So with my research, in my future, we treat like CT, prevent like MRI, all at once, to ensure that every patient gets the proper care in the nick of time. Thank you.